Allow me to introduce the chair of our webinar, Dr. Douglas Webb.
Center for Good Governance and Tobacco Control for our annual check-in on the behavior of the tobacco industry and the launch of the 2021 Global Tobacco Interference Index. It's an important conversation. We are delighted to welcome speakers this year from WHO, from PAHO, from Spain, Romania, India, Botswana, and the organization I come from, UNDP. My name is Doug Webb. I'm with the HIV Health and Development Group and in New York, and it's my important task to lead us through this conversation today. And we are going to start off with a video which explains a little bit about the background of the Tobacco Interference Index this year. Okay, so we are all here because of one lady, that is Mary Assunta, who's the head of the Global Center for Good Governance on Tobacco Control, the inspiration behind this index. And it's, I think, a fantastic piece of work, and which inspires so many of us to get on with our work. It's a collaboration of many actors across many countries. It's only been going a few years now, but I think this has got a big future ahead of it, and we're all looking at it with keen interest. So Mary, over to you to explain where we are with the index and what this year's index has said, especially given the pandemic that we're all experiencing and how this is affecting the behaviors of the institutions, the governments, the industry itself. Mary, welcome.
Thank you very much, Doug, for that very kind introduction. Hello, everyone. Today is a very special and important day. GGTC and STOP are pleased to release the findings of the 2021 Global Tobacco Industry Interference Index. This is a civil society report that reviews government efforts in implementing the WHO FCTC Article 5.3, and may I stress that this is the outcome of the work of 80 collaborators in 80 countries, and all of their colleagues together with my colleagues and also at STOP. So it's a very large team of people that have been responsible for putting this together. Next. Article 5.3 is an important clause in the FCTC, and which comes under the section on obligation in the treaty. So the guidelines is to assist governments to develop their efforts and their measures to put in place some protective governance measures that they can then help to protect their tobacco control measures. So in 2008, guidelines were adopted. So where are parties after 12 years in the implementation of Article 5.3 is probably the question that we would ask. Next. So the parties submit their reports once every 2 years to the COP, that's the Conference of Parties, with regards to the status of the implementation of their tobacco control efforts. And the parties to the FCTC have actually identified tobacco industry interference as their biggest challenge in their efforts to implementing the FCTC. Next, please. So we've prepared this index as a report card to view, or rather to review, government efforts in the implementation of Article 5.3. This way, we can identify areas of weaknesses or identify loopholes. So there are 7 indicators that we have selected from the guidelines itself. And these 7 indicators are how the tobacco industry has been allowed to participate in policy development, have governments received or endorsed CSR from the tobacco industry, what kind of benefits they have given to the tobacco industry, unnecessary interactions that take place, and is it done in an environment of transparency when those interactions do take place, areas of conflict of interest, and of course, then what measures have government put in place to protect their tobacco control efforts. As you can see that in 2019, we covered 33 countries in the survey. Last year was 57 countries. Next, please. And this year, we've covered 80 countries. So in 2021, you can see that no country has been spared from tobacco industry interference. So I'd like to just mention that the way this index works is that the higher the score, the worse the level of interference. So countries should aim to get as low a score as possible. And but you can see that from this map right across the globe that there are varying degrees that countries have experienced in terms of interference. So basically, countries should aim to be in the yellow category and not in the red and the maroon categories. Next, please. So out of the 80 countries, we looked at the reports that civil society groups in each of those 80 countries submitted. We reviewed the findings, and then we applied scores and ranked the countries accordingly. Next, please. So what are the main findings of this year's index? So we're going to look at the top performing countries, that is countries with the least level of interference. And you've got Brunei, New Zealand, and the United Kingdom among the top 3, and followed by France and Uganda. And at the other end of the spectrum, you've got the Dominican Republic, Switzerland, Japan, followed by Indonesia and Georgia. And the point is this, that the countries that face or experience a high level of interference is reflected in actually in poor or rather in not good tobacco control measures in their respective countries. Next, please. So we do have some good news. While the tobacco industry interfered in policy development in many governments, a few did make progress to protect their policies, and they are Botswana published tobacco control law limiting interaction with the industry, prohibiting partnerships and giving of incentives. The Indian Health Ministry adopted a code of conduct in July of last year, restricting collaboration of officials with the tobacco industries. And in Cambodia, the Ministry of Education, Youth and Sports banned all forms of partnership with the tobacco industry among educational facilities. So while these governments were putting in place good measures, the industry was able to interfere in and legislation was delayed in Guatemala, South Africa, Tanzania, and Zambia. Next, please. The pandemic dealt a severe economic blow, on many countries, and the health sector particularly, was, or rather is in urgent need of help and resources. The tobacco industry, we observed, stepped up its charities during the pandemic. And please go to the previous slide. Thank you. Stepped up charities during the pandemic, although Article 5.3 calls upon countries to denormalize CSR. And however, it was business as usual for the tobacco industry. So I'd like to begin by identifying a few countries that rejected or did not accept CSR from the industry, like Chile, Cote d'Ivoire, Ethiopia, Gabon, New Zealand, Netherlands, and Norway. On the other hand, Myanmar, Philippines have got restrictions on CSR activities, but they accepted charity from the industry during the pandemic. Another observation we made was that 11 countries that accepted the charity from the industry, then it seems to be reflected in their decisions on taxation. We noticed that in 11 countries, that is including the Czech Republic, Malaysia, Myanmar, Paraguay, and Turkey, who received donations, they seem to have compromised on their on taxation of tobacco. Either they did not apply a tax increase, or it was minimal, or there was a difference between the different types of products, or a delay in the payment of excise duty. Next, please. The FCTC is unique in that it's the only treaty dedicated to regulating an industry. And the treaty aims to reduce tobacco use and also to reverse the harm that this product inflicts on society. Yet, during the pandemic, the industry was able to persuade a few governments to consider cigarettes as essential. So in the case of Bangladesh, Jordan, Sudan, Malaysia, Kenya, they categorized or rather deemed cigarettes as essential item during the lockdown. And in the case of South Africa, which banned cigarette sales during the lockdown in March of last year, the industry sued the government. So this is really a bullying tactic that we saw in South Africa. Next, please. And the tobacco industry convinced lawmakers in several countries to treat new tobacco products differently or favorably. So in the case of Kenya, Lebanon, Egypt, and Spain, the industry was able to persuade lawmakers to regulate ends rather than to ban them, and also to regulate HTPs. And they said that they were concerned about children and about health, but they wanted these new products to be treated separately and differently from cigarettes. Uruguay was persuaded to reverse a previous ban that they had applied to ends. So last year, through a presidential decree, they have now allowed the sale of ends. Next, please. Right. Governments also forged agreements instead of regulating the tobacco industry. So the industry in Colombia, Dominican Republic, Ethiopia, Italy, and the Netherlands secured a collaboration or partnership with the industry, particularly in the area of addressing illicit trade, either to conduct training programs or participate in enforcement activities. And this is in contrast to what the Article 5.3 actually requires, which is to limit interaction to only when strictly necessary for the purposes of regulation. Next, please. So how did overall countries do? On the whole, the good news is that 18 countries showed an improvement. So with the index, when we do it every year, we're able to track how countries are performing. So when we compared countries that participated in 2020 compared with 2021, we found 18 countries actually improved in their scores. So those countries are, Spain, Chile, Sudan, Israel, India, and you'll be hearing some presentations later on. So they have got minus points there, which means that they've improved their score. And on the other hand, you've got Peru, Uruguay, Solomon Islands, Argentina, USA, not doing well because they deteriorated. And so their interference has increased, and that affected their scores. Next, please. So how can governments protect themselves? You must remember that Article 5.3 is to be applied across all governments. So it's a whole of government approach that will be effective, and not just the ministries of health. And from the findings that we have presented, you will see that there are several countries from low and middle income countries that have actually done well. The point is this, that it's not expensive to do tobacco control, particularly to put in place measures on Article 5.3, as long as you take a whole of government approach. So what is needed is for governments to be transparent when interacting with the industry. remember to limit it to only when strictly necessary. Governments need to firewall themselves and apply rules of engagement, perhaps develop a code of conduct, which several countries have done, and some countries have actually legislated these measures, as in the case of Uganda. Require the tobacco industry to report not just on production, but also what they spend on marketing, what they give to retailers, what they spend on lobbying, political contributions, if they're not banned, etc. So transparency, is really very important, and also in terms of information from the industry. When transparency takes place, it's also important that there is a procedure in place, and this will, when you shine the light on the industry, then governments will not be making deals behind closed doors. And then, of course, it's really important to increase awareness across all government departments if you want to deal with the tobacco industry interference. Next, please. So with that, on behalf of GGTC and STOP, please visit our website, exposetobacco.org, where you will find information on the index which can be downloaded, and also visit the globaltobaccoindex.org, which has got information on customized fact sheets for all of the 80 countries, and also country reports. When they're ready, we will be uploading them. And with that, thank you very much, and I look forward to answering any questions you may have. Thank you very much for this opportunity, and good luck when reading this report and putting it to the application. Thank you.
Thanks. Thank you, Mary. Congratulations again to you and STOP colleagues and everybody that got involved in this this report. Just listening to you describing it, it's clear that the industry has really upped its game during the pandemic, with the irony, of course, that COVID is a lung disease, essentially, or it's a respiratory disease which manifests as a cardiovascular disease. So when the spotlight is on lung health, the tobacco industry, looks to sort of present itself as a force for good. At the same time, that governments are under increasing fiscal pressures, or fiscal space is being contracted, and it's the vulnerabilities around fiscal space are more exposed. So it's more difficult for governments to, in a sense, resist the sweets from the not so strange, as it were. And so there's this dual pressure coming in from the industry, and also the donations that we've seen in terms of the ventilators and PPEs and so on. So there's this sort of COVID has presented an opportunity, as it turns out, for the tobacco industry to present itself as the solution in many ways. So I'm sure we've already got lots of questions. The Q&A function is open, so if you've got questions for the speakers, the panelists will be ready with short and 100-character answers for you. So please feel free to ask questions. We're not going to have much time for verbal Q&A, but please write away in the Q&A. So we're going to look at some of the countries that have been successful during this period. Now, it helps the moderator to keep people to time when the panelists tell us they have a meeting with the boss, and can they quickly present. So Samuel Kulane from the Ministry of Health in Botswana has this challenge on his hands. So without much ado, Samuel, you have had good experiences in Botswana in tackling the pressures of the tobacco industry. And then we'll move to the example of India, which has had similar successes. So Samuel, over to you to tell us what have you done in Botswana that you can teach us. Welcome.
Yes, thank you very much. Like you were saying, I'm running out of time. I have a meeting with the boss, so I'm going to try and make this as quickly as possible. So next slide, please. As history has shown that the tobacco industry has had a lot of influence, or tried to influence what is happening in most countries. And Botswana is no exception. And there is a history of, the history that shows how deadly tobacco is. And there are studies that we've carried out as Botswana to show the harm that the tobacco is doing to both the health and the treasury of the country. In 2017, about 240,000 of the country's adult population or older used tobacco. And there's the results that we got from the studies that we carried out. And tobacco use rate is the highest of any country in the region. And that was what was revealed. Next slide, please. And as a country or as a government, obviously we've had to respond in a certain way or show commitment. And the government of Botswana first enacted the Control of Smoking Act in 1992 to regulate cigarette smoking and prevent exposure to tobacco, as well as regulate or to try and limit the influence of the tobacco industry. And we also signed and ratified the WTC, FCTC in 2003 and 2005, respectively. Next slide, please. In 2004, to try and cater for the signing and the ratification in 2005, the government of Botswana amended the Control of Smoking Act of 1992. And one of the things that we were looking at was the minimum age restriction of persons who could buy or sell tobacco products. And we also introduced the tobacco levy in 2014 as a way of also influencing the use or stopping the use of tobacco. Next slide, please. Yes. Oh, next slide, please. Next slide. And what battles have we faced as a country in as far as the influence of the tobacco industry? No, back, please. Yes, looking at the influence. Back again. Yes, it's okay. We've looked at the influence of the tobacco industry and the government departments. No, just back, please. Oh, next slide. Next slide. I think you've moved back. You've moved backwards. Next slide. Yes. Let's pause there for a moment. Yes. What battles have we faced as a country? Like I was saying, even government departments did not. They also faced this influence one way or another. And this was recognized through the influence the industry tried to have on the police department. They donated, they made some donations to the Botswana Police in 2012. In 2013, the Botswana Unified Revenue Services signed a memorandum of agreement with the Tobacco Institute of Southern Africa to curb illicit trade in tobacco. In 2014, the Ministry of Agriculture signed a memorandum of agreement with tobacco industry on food security. In 2015, Business Botswana also on a youth undertook some campaigns on smoking prevention, also supported by the tobacco industry. This indicates that the law that was there could not limit the tobacco industry influence. Next slide, please. And this then evidence that we needed to amend the law. And this, we have done that successfully this year. I'm happy to report that in August 2021, the Botswana Parliament passed a new law that deals with controlling tobacco and also encompassing all the provisions of Article 5.3, FCTC Article 5.3. And this was, of course, not easy because the tobacco industry infiltrated even some members of parliament. So there was a robust discussion in parliament before the law was passed, but we're happy to report that it did pass eventually. And this we did not achieve on our own. There was a solid partnership between us and civil society organizations and the WHO country office. We put together a united front to fight off the machinations of the tobacco industry. And what is important now is for that partnership, because the law is just awaiting the signature of the president, it is important that the partnership that we've had should continue, where we're going to be focusing on public educations to fight off whatever challenge that they may mount, because we know of their influence, we know of their machinations, we know, we've seen how they've done in other countries. So it's important that we sustain this partnership and be on the guard to fight off whatever challenge they may mount. Next one, please. Next slide, please. I think this is just the last slide to say that, yes, as a government, we've done very well. It's a first. Botswana now ranks among one of the few countries that have successfully passed the law on tobacco industry. And now what is remaining is for His Excellency the President to sign the law, and then all the campaign's comments. Thank you very much. I'm sorry I've had to rush this because time is not really on my side, but I have Professor Mbongwe, who from the CSO in Botswana, the Anti-Tobacco Network, who is logged in. And if there are questions, I think she will take the questions. Thank you, Doug.
Thank you, Samuel. Colleen, thank you very much for your time, and off you go to your meeting. And I know that, you know, it's congratulations from all of us on the success you've had. And I know the partnership with civil society has been very important as well. We had a conversation about this, and it's a great case study in what you've done. So thank you for sharing that with us. It's also a lesson in the fragility of parliamentarians in, you know, in this conversation. They seem very vulnerable to interferences of all varieties. We moved quickly northeastwards to India, where pressures of all varieties are there too. Dr. Swasticharan from the Ministry of Health, welcome. What successes have you had in India along these lines?
Thank you, Doug, and thank you, GGTC, for inviting me to share the Indian story. Well, around 4th July 2020, India attempting to implement the articles of WFCTC had a landmark decision by the ministry for implementing the WFCTC Article 5.3. So in order to protect the public health policies from the tobacco industry interference, we came up with what is known as the Code of Conduct for public officials to comply with the WFCTC. This particular bunch of papers that we have here, I have here with me, is the particular Code of Conduct that we released to the Ministry of Health officials, as well as to all the organizations under the Ministry of Health to comply with. The key features of the Code of Conduct, we say in the covering letter itself that it should be, you know, whenever whenever there is a chance of interaction with the industry, we should at the most, you know, try our best not to interact at all. And when you think it is extremely necessary, when you know beyond doubt that it is extremely necessary for the interaction, then only the interaction with the tobacco industry should happen. But if that has to happen, it has to follow certain guidelines. And the guideline which goes with this, the Code of Conduct letter, is a 4-page document that we have here, which has got a background why we need to do this. And at the same time, we also say what is the purpose of this document. Then we define the scope of the Code of Conduct, and then we also define the terms. What do we mean by tobacco industry, and what do we mean by tobacco industry interference? And then we highlight more on the kind of interaction with the tobacco industry, and also tell whoever is going to read this document about the partnership and the contribution. What is the partnership and the contribution or defined in this document? And we also explain why there is a conflict of interest with the officials of Ministry of Health with the tobacco industry. And if there is a violation, then we also give the focal point to which the violation can be reported. The guideline also went with an annexure where there are certain things which we need to observe in terms of approval from the competent authority, why the meeting is required, and also having the agenda well before the meeting approved by the competent authority. And also we had to clarify that the interaction does not imply partnership or dialogue or collaboration, and it must be indicated that to the industry that they will not mischaracterize or misuse the nature of the meeting. And the participants in that particular meeting are also to be predetermined, and the officials have been briefed that the meeting is to be, it has to be very brief, and the interaction will happen only in the premises of the department only. And we also ask the official to look out for the welfare of the public by prioritizing the importance of public health. And the records of the meeting are to be recorded and documented well. Well, this is from the Ministry of Health. We also, time and again, we try to clarify again and again why this is to be done on several occasions, even during the pandemic. And we know that tobacco is beyond health and it is beyond Ministry of Health. So we hope in future that since we have started the charity at home, it should crisscross to other ministries as well, and we can have Article 5.3 implemented in a larger sector beyond health. This is the story that we have in India. Thank you so much, and thank you. Over to you, Dr.
Thank you, Dr. Swasti. I'm amazed when we talk to governments that the Ministry of Health may know all about Article 5.3 and other parts of government don't know it exists. It really is quite extraordinary. So they carry on talking to industry, regardless, without the understanding very often that this is supposed to be a conditioned dialogue, if that's the right phrase, a managed dialogue, a transparent dialogue, as we put it. So congratulations on trying to condition and regulate that conversation in India. We're going to jump to the global level again. Kirsten Schott, welcome from the Tobacco Free Initiative in the World Health Organization. How do we reject corporate social responsibility, if that's the right word or phrase, from tobacco industry during the pandemic when they're actually trying to increase it? What is the experience of WHO? How do we do this, and how do we regulate it? Welcome, Kirsten.
Thank you very much, Doug. Thanks very much for inviting WHO to contribute to this important launch. And yeah, we know already that the tobacco industry will stop really at nothing to increase its profits and trying to sell more products, even if it means exploiting a global pandemic that we have seen in the last 2 years. So this is why it has never been more important than now to really, for the public and policymakers, to see the tobacco industry for what it really is. It's an industry that sells death and disease. And we must make sure that decision makers and public health advocates know how the tobacco industry is capitalizing the COVID pandemic so that we can identify appropriate policy measures to counter the industry. So the next slide gives one example of how the industry is exploiting the pandemic, and that is lobbying. So we know already now from the research that smokers are up to 50% more likely to suffer worse from COVID-19 disease. And this means that smokers are more likely to have more severe symptoms, they're more likely to be hospitalized, more likely to be admitted into intensive care units and to need help with breathing or ventilation. And also ultimately smokers are more likely to die from COVID-19 disease in comparison to people that have never smoked. But yet the tobacco industry is trying to portray itself as a solution to this problem, which is quite sarcastic, I would say. And one of my colleagues has compared this like it would be a landmine company making money from people losing their limbs and then later on selling them prosthetics, because the tobacco industry is now investing in vaccines, for example. They try to find if nicotine maybe has a protective effect against the COVID-19 disease. And I will go into this later on. And also what we are seeing now in this pandemic is that the tobacco industry has tried to remain in business by lobbying that their products are essential in countries. Okay, let's go to the next slide, where I want to give some examples on how marketing has increased and has been capitalized in the pandemic. For example, from brand promotion of tobacco products and e-cigarettes on social media. And here on the left side of the screen, you can see an example from Pakistan, where social media influencers were paid to promote e-cigarette products. Also, we have seen that the industry has offered special promotions and sales during the pandemic. And also they have tried to undermine minimum age purchase regulations by offering free shipment to users and internet sales. The next slide, very worrying, is the misinformation that has been happening. Especially, maybe you remember in March last year, in several countries, false information has been spread that smoking or vaping might be protective against COVID-19. And there are also recorded instances of scientists that had financial links to the tobacco industry, and they published related research without declaring these tobacco industry links. And what is not surprising is that in these cases, the research has tended to support this nicotine hypothesis that nicotine might be protective of COVID-19, which has been dispelled now. But what is really interesting, I think, about this case is that this tactic is absolutely not new. Influencing the scientific debate, as we see now with COVID-19, is a historical tobacco industry strategy. And the key aim in influencing science is this creation of a doubt in the public around a given topic. And we have seen this in the past about secondhand smoke, about the addictiveness of nicotine, and links to diseases or other arising public health issues. And these calls that more research is needed always buys the industry time in implementing regulation, and it draws out the debate and confuses policymakers and the public. So it's very important for us in public health to provide clear information on research. And in response to this misinformation that has happened last March, WHO, for example, has published a Q&A and a scientific brief about COVID-19 and tobacco that is still available on our website. So next slide, I want to talk briefly about CSR. Unfortunately, the COVID pandemic has given the tobacco industry an opportunity to knock on doors of policymakers, because in many countries the pandemic has really strained the system. It has strained financial resources. And so the tobacco industry had an opportunity to offer immediate donations, but it doesn't come for free. It was very often in exchange of favors down the road. For instance, in Indonesia, the tobacco industry, we know, made donations and then asked the local government of Bali to roll back restrictions on outdoor tobacco advertising. What is very sad about this is that ultimately the public, the citizens, will pay a price for their governments accepting tobacco industry donations, because in the end, we know this means more harm death and disease from tobacco products. So the next slide, what can we do about this? So not only do we have to unmask these tobacco industry tactics and show the industry for what it really is, but also we think it's very important to denormalize the whole tobacco industry, and so that people see them really as, I think they see, for example, the weapon industry. Nothing good comes from them. And of course, as Mary has already mentioned, the implementation of Article 5.3 is key for all governments, with all the topics that have already been mentioned. But what is also important is that we have complete tax bans in all countries. We call this also the mute button on the tobacco industry, so they can no longer promote, for example, their CSR activities. If they want to make donations, that's bad enough because they can influence governments, but then don't talk about it to the public and portray yourself as a good company. And then what I already mentioned, spreading correct information is important for us, and to run very effective social media and anti-tobacco mass media campaigns that help denormalize the industry. So next slide. I want to thank you again for giving us the opportunity to participate in this launch, and congratulations on this important publication. Thanks very much.
Thanks very much, Kirsten. That's great. And I know there's going to be regional indexes launched, and in the Americas, certainly in North America and the US, there's been an increase in both tobacco sales and expenditure on advertising promotion, linked to exactly what you've been describing. Thanks very much for that overview. We're going to go back to countries now for experience and some case studies of industry exploiting the pandemic. And I want to invite Ramona Brad, who is the director of the 2035 Tobacco-Free Romania initiative, to look at some of how the industry is really used in nefarious ways, this vulnerability of government. So Ramona, welcome. And what's your experience in Romania of this phenomenon? Welcome.
Thank you. Thank you so much for the invitation and for the opportunity to speak to you today. I would like to especially thank the team that has worked intensively across all countries to put together this edition of the Tobacco Industry Interference Index. I think my presentation is pretty well linked with the previous panelists' comments and information related to how the tobacco industry has interfered with public health during the COVID-19 pandemic context. Because I think most of the tactics that we have seen across the previous indexes are not somehow different one year after the other. They are somehow repetitive. There is a certain handbook of the way the tobacco industry is interfering with public policies making. However, I think that the COVID-19 context, in a way, was an even greater visualization of the conflict between the public health objectives and the tobacco industry interests. And I pretty much like somehow to refer to the tobacco industry as a virus in itself. And I even named my presentation as such, because the question that I have constantly asked myself is, okay, how has the tobacco industry has mutated again and again over the years, but obviously, how did it mutate during the COVID-19? So the look at the Romanian strain of this COVID-19
Ramona, you're on mute.
I'm sorry, can you hear me now?
Yes,
Okay.
we can. Thank you.
So during the COVID-19 context, the tobacco industry in Romania has intensified its activities with policymakers, in a way taking advantage of the situation to gain a seat at the table that they were almost never invited to, and that is a public health policies making table. As you can see from the slide, tobacco industry and tobacco usage impact on Romania is quite high. There are some impact studies which we have conducted over the last period of time, which shows the economic impact of tobacco use. And if you look at this economic cost of tobacco, which is on a yearly basis estimated at $5 million, you would see the conflict that has with the donation that Philip Morris has done in 2020 at the onset of the pandemic, of $1 million to the Red Cross Romania. The additional issue with that donation was that Red Cross is one of the international organizations that has prohibited through its code of conduct dealing with tobacco industry altogether. So to us was quite surprising that the Romanian Red Cross would accept such a donation. When we confronted both the regional office of the Red Cross, but also the local office, obviously the stories didn't match. And finally, what we have enabled through this engagement to do was basically to make them not promoting this donation as they would have liked to in the beginning. So at least that it's a good outcome of the advocacy activities that we have engaged with in order to preempt this kind of activities in the future. That was one example of Philip Morris donating to the Romanian Red Cross. There was another instance of British American Tobacco doing the same, pretty much the same across the same lines. The next slide, please, if you can help me with. BAT has again tried to set a precedent with the Romanian Ministry of Health, trying to donate to the Ministry of Health of Romania ventilators, which are obviously very much needed in the COVID-19 context. We managed to engage again very effectively with the Romanian Health Ministry and preempted this becoming official. And as a result, this donation was no longer promoted in the media. What I think these two examples, these real life examples of how the tobacco industry has interfered in Romania, is bringing us back to the discussion that we are very well familiar with, of the need to have a code of conduct for public officials to guide them when dealing with the tobacco industry. The need to have a procedure to limit the interactions with the tobacco industry to only when strictly necessary, and to have a strict code of conduct, especially at the level of health institutions and health professionals, to guide them when dealing with the tobacco industry. The government obviously has to do more in terms of raising awareness on policies related to Article 5.3. Romania is a signatory of the FCTC. However, we do not have a full taps ban in place. This is an additional difficulty for us in dealing with the Romanian health officials. And also we need to work further as advocates in Romania on reinstalling the transparency registry, which used to be effective and working in the past, but it's no longer the case. So I would like to thank you for allowing us to bring these snapshots of Romania's tobacco industry interference specific examples during the COVID-19 context. And I hope that the sharing of examples and good practices and bad practices across the world would help us to further push the public health policies on tobacco control that are much needed. Thank you so much.
Thank you, Ramona. Fantastic work. keep it up. The value of these donations is way more than $1 million in this case to the industry itself. So it's really important that these are exposed and action is taken afterwards. There are many of them, and we need to keep a close eye on what is going on. So good luck in that. We'll rush over westward slightly to Spain, which has the distinction of being the most improved country in this year's index. So of course, Armando Perugia, who we know from TFI days and WHO, but is now at the Catalan Institute of Oncology in Spain, will explain in less than 5 minutes how Spain has done this, the network of yes in Spain. What have you done, Armando? Welcome.
Thank you, Chair, and thank you, Mary Assunta, and the whole GGTC team for the opportunity to participate in this important exercise. On behalf of the Spanish team, which is made of Esteve Fernandez, Olena Tigova, Rodrigo Cordova, Francisco Rodriguez, and myself, we would like to convey that the example of Spain indicate that efforts to counter the interference of the tobacco industry pay off, but there is room for improvement. More specifically, we would like to make 3 points about being the most improved country in this edition of the Tobacco Industry Interference Index. First, we have improved 9 points over the score of the previous report, which encompassed the period 2018 and 2019. Then we had 63 points out of a maximum of 100, and now we have 54 points. Remember that in this index, as Mary has indicated, less points is better. And therefore, we are glad that we are the most improved country of the 57 countries with the trend data to compare the two reports, the one in 2019 and 2020. So the first message is that improvement is possible. I think Mary has made it very clear when presenting the data that some countries have improved, and we bear the honor in Spain that have improved the most. And the message is therefore that improvement is possible and efforts to counter the interference of the tobacco industry pay off. Second, nevertheless, we would like to put this improvement into perspective. Although we have a relative improvement of almost 10 percentage points in the score of the index, Spain still has a modest index score compared to countries like, for example, France, just to mention a neighboring country of Spain. France has a score almost half that of Spain. Spain, despite improvement, is still in the middle of the pack. So the second message is that there's room for improvement. Third point that we wanted to make is that the improvement in the Spanish score comes mainly from a decrease in unnecessary interaction of the government with the tobacco industry. In the previous report, we noted that Philip Morris, for example, gave to the police equipment and participated actively in the training of national and local law enforcement agents combating illicit trade. In return, the police awarded Philip Morris with a distinction. After years of civil society denouncing this collusion in combating illicit trade, this year it was not reported. It has either ended or they are hiding it very well from the public's eye. Another area where we have noticed improvement is in the lack of meetings of top-level government officials with the tobacco companies in 2020. Although this can be due to the restrictions imposed during the COVID-19 pandemic. Given the nature of the improvements, these improvements can be reversed, and as civil society we need to keep pressing for consolidating improvements and pursuing further progress. So the third and final message is that there is no room for complacency. I would like to end with a summary saying that efforts to counter the interference, as per the example of Spain, the interference of the tobacco industry seem to be paying off, but there's no room for complacency, but lots of room for improvement. And civil society and the group that I represent will continue to work hard to make these improvements a reality. Thank you.
Dr. Armando, thank you. Very interesting. I have 1,000 questions I'd love to ask you. If only we could get on aeroplanes and go and talk to people. Very good. Thank you for your analytical summary. We've got a couple more speakers, so we may drift over the hour, but we'll rush across the Atlantic to Rosa Sandoval, who we all know from PAHO, who's interrogating this question of member states battling with the FCTC and tobacco control within COVID recovery and the economics of all of this. Rosa, is there how do we look at tobacco control and tobacco taxation and all of this part of the economic recovery from the pandemic, which we all assume is happening, but what is going on? Rosa.
Thank you, Douglas, and thank you, Mary and colleagues at the GGTC for inviting PAHO to contribute to the discussion today. So yes, the role of tobacco tax policy as part of economic recovery from the pandemic. Next slide, please. Let me start with two ideas or two things we knew from before COVID-19. First of all, we've known for a while that tobacco tax is a very cost-effective intervention. The single most cost-effective intervention we've been saying for a while, and we have there the NIH monograph from 2016 with two messages already. One, as I said, the single most cost-effective tool for reducing tobacco use. And the second one, that despite that, this is the policy that it's among the least implemented. And the next one, please. The situation was not different in the region where I come from. I'm obviously speaking mostly from my experience in Latin America and the Caribbean. The situation was similar in the sense that this is not a policy that has been among the most implemented in our region. And Latin America, if we look at the scorecard that our colleagues from the University of Illinois published recently, we will see that Latin America scored 2.26 points out of 5. The Caribbean countries even less than that. But we did find some countries as Peru and Ecuador, and I will talk about this later, that had made progress in terms of using excise taxes on tobacco as a way, with the purpose of producing health outcomes, positive health outcomes, but still remain as an underutilized policy, according to our colleagues, which matches what we in WHO and PAHO our assessment in terms of the use of taxes. We have the calculation of the tax share that I'm sure you've seen. And we also, when we look at the tax share in our region, we see that just a few countries have reached the benchmark as WHO establishes it. We have also countries like Paraguay who have, for a while, have really a very low tax burden on tobacco products. We see countries as Argentina that tax share have been going down in the latest years. We see countries like Guatemala and Costa Rica where the effective VAT tax rate is much lower than what it says in the legislation, and that if we look at news reporting, we will see in the news that there is claims that the tobacco industry were behind these changes. The next one, please. So that's the situation before COVID. We have COVID then, and as we all know, right, this very strong relationship between infectious disease, COVID-19, and NCDs. And in this context, the next one, please, we, and by we, I mean those of us working on tobacco taxes, but also on taxation on other harmful products linked also to the NCD pandemic. We were expecting to see, and this is back to your question, Doug, what's going on? So we were expecting to see that Minister of Finance colleagues and looking into how to have increased their revenues, right, to respond to the pandemic, whether they would look at excise taxes, as this policy that we've been saying for a while is a win-win policy. And we did have the case of Paraguay, first Mexico in April 2020 with a bill calling for increasing taxation on harmful products, including tobacco, sugary drinks, alcoholic beverages. The next one, please. The same situation we saw in Paraguay, and even calling specifically for the calling attention on what Ramona was just saying, how the revenues from tobacco taxes are really a very small percentage of what the state has to pay for the cost of tobacco-related diseases. The next one, please. Short story, because I know we are running out of time. Both bills did not progress. And Douglas and Mary asked me, so why it happened? Why it didn't progress? Why we haven't been able to position these interventions as interventions that are positive for health and for the fiscal, from the perspective of fiscal policy as well. So you can look at these are news in Spanish, but I can tell you that basically, in the case of Paraguay, there was a call for this is not a moment to increase taxes. And then in the case of Mexico, there's been a promise from before the pandemic on the part of the president as not to increase taxes. So it seems like we're in these both cases, we are talking about taxes as one thing, like for example, income taxes, which most of us don't like. And but so the perception among policymakers is that these taxes, these type of policies are not supported by the public. Although I'm sure many of you have seen or have implemented polls when you are advocating for increasing tobacco taxes, and you see that even smokers are support increasing tobacco taxes. So we need to change that narrative. The narrative from these taxes are not, that policymakers see these taxes are not supported by the public, to the narrative of these taxes are actually accepted by the public. People see that are beneficial to vulnerable populations, so we need to build more on this, and they make sense from a development perspective. The next one, please. So I do see that we have an opportunity here, and in the context of the pandemic, what I can see is that there's been, I would say, a consensus among many people, not beyond the health sector, on looking at these interventions that are useful to address the pandemic from an immediate point of view, but also from a long-term point of view. And there are some quotes and from discussions that we've had and we've hosted with colleagues from the World Bank, from the IMF, from Inter-American Development Bank, from the Economic Commission for Latin America and the Caribbean. So all these organizations working, not necessarily working in health, but from a development perspective, or even the IMF working most on fiscal policies, a consensus. Health taxes in general will improve health outcomes, help raise revenue, especially in the short term, and could decrease health system impact of future waves. So consensus about it, an opportunity. The next one, please. Yes, so these policies, as I said, there's a consensus, they are both effective and bold. And while I do think that we need to calibrate our expectations regarding the revenues from tobacco taxes, if we look together at the revenues from tobacco products, SSDs, and alcohol beverages, revenues are not trivial. So, and we need to position more and more, and keep saying this, that there's these are immediate source of tax revenue. Excise taxes have been used before to address earthquakes or natural disasters. This is not a new story. And also highlight the long-term contribution as they contribute to healthy population, but also to the financial sustainability of health systems, which is something that is very worrying at this moment on the part of health authorities, fiscal authorities, development authorities, and the next one, please. So I think we do have to expand our wins. We've been talking for a while about the first win and the last win in terms of improving health outcomes and the possibility of these being revenues to finance development. But we need also to make it more visible, the contribution to the financial viability of health systems, and to increasing productivity and well-being in our population. And win-win-win, repeat, repeat, repeat. We need to keep working on changing that narrative that have prevented so far, that have prevented us so far from using this policy as intended here. Thank you, Douglas. Over to you.
Thank you, Rosa, and sorry to push you for time. The message is simple: health taxes, tobacco taxes are part of pandemic preparedness and response financing as well at this time. They are so important. Thank you for that. Now, last speaker, who I will push for time because he's my colleague, Dudley Tarleton of the UN Development Programme Health Team. Why, Dudley, are we as a development program, as development organization, interested in Article 5.3? What have we been doing with it? How do we use the index in our work? What is going on? Over to you, Dudley.
Thanks, Doug. Hi, colleagues. Really quick run through here of some of the work we've been doing that really can be helped a lot by this index and the new findings and the year-on-year findings as well. Next slide, please. Quick run through. These are somewhat old numbers, but the list of the main barriers the parties report themselves as, you know, the obstacles to greater FCTC implementation. Next one, you can see the number one barrier is industry interference from the tobacco industry. Next one, please. And again. So what we do, most of the support we're giving to countries on tobacco control specifically is under the FCTC 2030 project. And it centers on Article 5 support broadly. And there's three parts of this I'll run through. You can see we're helping countries either strengthen existing tobacco control national strategies or launch the process of drafting new ones. And I have some countries listed here. And we use a tool that we've developed together with the FCTC Secretariat that outlines and really just, you're able to do a little bit of hand-holding with the countries to make sure. But Article 5.1 is a really key entry point for getting Article 5.3 right later. Next one. And again, like with the strategies, Article 5.2a on the national coordination mechanisms is really key. This is a really key chance for us to bring into the tent some of the key stakeholders who might be the resistance to greater tobacco control, get them on our side, understand that tobacco control is in their interest as well. So we really try to make the NCM establishment and strengthening as inclusive as we can. And here's some countries listed here. And again, another joint toolkit that we use to give the support done with the Secretariat of the FCTC. Next one, please. Some countries do ask for specific support on Article 5.3, and I can give a quick example of how we tend to give this support. In Fiji, they requested, a really start from the beginning approach on Article 5.3, how to put it into practice. And we've worked with them to prepare this discussion paper, and I just pasted the contents here, you can see. But we're really able to pull from a lot of sources, including what's worked in many countries, and share those experiences in this. And this is on top from the already super helpful COP guidelines on 5.3, which is a great starting point. But sometimes it's good to tailor some of these things to the country context, which we've done in Fiji. Next one, please. I think we passed one. There we go. So really what we're trying to get when we give this tailored support to the countries is just a much broader awareness of the Article 5.3 exists, the tobacco industry have no place in sustainable development, and how to watch out for interference in policymaking. And we often, in some, like in Fiji, make roadmaps for how to specifically strengthen codes of conduct and give specific support in drafting those codes of conduct as well. Now, next one, please. Okay. Examples we've drawn in, sort of this South-South cooperation that comes up through this FCTC 2030 project. We've got great examples from countries in the project that are shared with other countries who are asking for support in the project. And you can see here some guidelines on protection of public policies from Sri Lanka. Chad have a great presidential decree we use. Myanmar, of all countries, even though they don't always score great, has a strong directive on industry interactions. Australia and the UK both have good, strong guidance that they give to public officials. And in the UK, it's specifically for those in embassies who often, could be places where industries get a foothold in policymaking. Next, please. Did a quick analysis of the year-on-year changes in those, I think it's 33 countries now that we're looking at under this FCTC 2030 project. I wouldn't draw too much from this because there's just the population of countries that, countries we're working in that match those that are surveyed aren't so big, from between 11 2 years ago to 21 now. But we can, draw a somewhat of a picture of things getting a little bit better. The average score on the index is going down among these countries. After going up last year, it's down a bit again. But there's a lot of, really stories in here and specific items that for us to dig into in our work. And I've highlighted a couple here with things that are happening right in Pakistan, Sri Lanka, and surprisingly Egypt. And then some places where things are not going the right direction with Iran and Laos. And Iran especially is a surprising one as well, because they generally score so well. So we're not putting too much stock into the numbers that we find here, but it is something we're keeping an eye on. And we do intend to use these findings and the index in every investment case that we're doing. We launched in Armenia yesterday, and really the numbers really support a systematic approach to making sure there's a whole of government response to tobacco control. Next one, please. I'll put in the chat maybe some of the links to these resources. Some are ours, some are other partners, but they're all really useful by the time we get into the countries. The more country specific examples that we can draw from, the better, the better chance the countries have in doing this. It's hard work. The progress is going to be very slow with this, and the impact from the progress even slower than that. But we're in it for the long haul. We know that it's really important work. We really see getting Article 5.3 right is the key that unlocks everything else in tobacco control. And we need to center our efforts on this outside of the health sector as well. It's really, if the health ministries aren't the main problem, as we can see from the new report that they're really not, we can't expect them to be the exclusive solution to this. So we're going to work with our partners to make sure that the ministries of trade and industry, ministries of finance, ministries of economic development, and certain committees in parliament really are on our side, know the stakes, know their role, know what they can benefit from tobacco control. And we think this will help give a push to everyone else's efforts. Next one, I think that's all. Thanks. Happy to take any questions later if anyone has one.
Thank you, Dudley. I think, as UNDP, and we're in terms of good governance, and this is our sort of mandate here, anything which quantifies and benchmarks and allows us to systematize and compare and work across countries is really valuable. I mean, just to say this, because the peer pressure cross-country that this allows is really useful. And it allows countries to situate themselves internationally, and it is motivating. There's no question about that. Because as we've heard from the speakers, while progress and improvement is possible, so is regression. And we need to sort of understand, as we see these trends and patterns occur, what is in a sense, the political science that underlies these movements. And if we do see an improvement over time of certain countries, what would be the anticipated speed of that improvement? What would be an acceptable movement forward? What would be an outlier? What would be within the bell curve? What would be the standard deviation that we would expect, as it were? We need to understand the science of the drivers and how to overcome the incoherence that we see across governments. The parties that complain about industry interference are the same parties that are actually taking money from the tobacco industry. So what is the management of the incoherence, and that we need to understand the Achilles heel of the public sector? Where is it? Where is the exposure? Is it in legislation, parliamentarians, different parts of government? How do we work on that? So thanks so much to all the speakers. It's been a fascinating conversation that will continue. I can declare that the 2021 Global Tobacco Industry Interference Index is officially launched. So please use it, read it, understand it. There's a great, that fantastic graphic. Tweet it out, send it out, and use it, disseminate it. Look at your country and learn from other countries as well. This is a moving dialogue, and it's obviously theorize about the counterfactual. If we didn't have COVID, where would we be, and understand what the dynamics of the pandemic are. Thanks so much for the Global Center. Thanks so much to STOP. Thanks so much to Mary and all the colleagues involved. We'll see you next year, but there's a lot of work to do in the meantime. The regional dialogues will go ahead. And thank you all for being involved. We still got